with our discussion being on drug overdose, the first thing I'd like to do is just kind of give you an overview of what our discussions are. So, looking at our overview, what we'll be discussing is one, the definition of a drug overdose. We're looking at the U.S. prevalence of drug overdose, death rates, and the most dangerous drugs that cause these overdoses. We're looking at symptoms of drug overdose, risk factors, paracetamol overdose, which, believe it or not, you know something about already. The treatment, prevention, and community resources for drug overdose. So let's begin. The faces that you see here are the faces of individuals that were celebrities, all of which who have died from drug overdose. So, what is a drug overdose? Well, medically speaking, a drug overdose is defined as consuming of a toxic substance that can either be prescribed, over the counter, or an illicit drug. And this can happen accidentally, as Heather indicated, or intentionally, and can result in serious health issues and death. The severity of an overdose can depend on things like the amount of the drug you took, the individual's tolerance for certain drugs, and their overall health condition. The mixing of different drugs or using after having been abstinent for a period of time increases your risk for overdose. It's important to remember that overdose is a medical emergency and it requires immediate attention. And if you suspect that someone has experienced an overdose, call for medical assistance immediately. So when we look at the U.S. statistics regarding drug overdose, the United States annual drug overdose death rate doubled between 2015 and 2023. We went from 16.25 per thousand, per 100,000 population in 2015 to 32.76 per 100,000 population in 2023. And the contributing factor to the decline in life expectancy was drug overdose. Nearly 85% of the overdose deaths involved illicit, manufactured fentanyl, heroin, cocaine, and or methamphetamine. So when we talk about the death rates for population under 50, under the age of 40 have skyrocketed. And the belief is the use of fentanyl. Alaska now has the nation's second highest rate of drug overdose in the US. The deaths were about 53 per 100,000 population, and they're right behind only West Virginia with 73 per 100,000 population as of October of 2024. Opioids are responsible for the largest number of overdose deaths globally. Death rates from illicit drugs are the highest in the United States. And this is largely the result of the rise in opioid deaths in recent years. When we talk about the death rate statistics here in San Antonio and inclusive of Bexar County, we experienced a decrease in our opioid-related drug overdose deaths in 2024 compared to previous years, although the numbers still remain pre-pandemic high. Opioid-related deaths, as far as Bexar County was concerned in 2024, were approximately 33.5% increase from the peak of 269 deaths in 2022, but it still exceeded the 135 death record in 2019. And we're attributing that a bit of that to the isolation caused by COVID. Overall trends, there was a decline in overdose death, largely attributed to the wider availability of Narcan. And Narcan is a drug that helps to reverse opioid overdoses. It's important to note that there was a decrease in death, but it doesn't indicate a decrease or a reduction in drug use, which is even harder to measure. It just indicates that we were able to save more lives of individuals who had had opioid overdoses. In 2023, more than 2,000 people in the US, including 9 people in Bexar County, died every week from a drug overdose, according to the CDC measures. Bexar County has a higher mortality rate than the statewide average for both stimulant-related and opioid-related deaths, with 58% of those overdoses being deaths in Bexar County. When we look at drugs, there's an important difference that we need to understand between drugs that cause overdoses with opioids and those that were caused by illicit drugs. So what's the difference? Well, opioids are a class of naturally or synthetic or semi-synthetic drugs that include both prescription medications and illegal drugs like heroin. When we talk about opioids in general, we're talking about codeine, fentanyl, heroin, hydrocodone, hydromorphone, methadone, morphine, and oxycodone. All of these drugs fall under the class of opioids. Now, illicit drugs are those drugs that are manufactured, obtained, or sold illegally. They include prescription drugs that were either obtained or sold without prescription and non-prescription drugs. Illicit drugs are widely distributed, tend to be grossly impure, and cause unexpected toxicities, which then lead to those overdoses. The types of illicit drugs that we're talking about are those stimulants, depressants, narcotics, and hallucinogens. So when we look at the 10 most dangerous drugs causing overdose, causing health issues and death, alcohol, despite being freely available and legal in the majority of countries, remains one of the most destructive substances. Beyond alcohol, there's fentanyl, heroin, cocaine, methamphetamine, Xanax, oxycodone, ketamine, morphine, and diazepam. These drugs are the major contributors to death overdoses in this country. So when we talk about overdose itself, it's important that we know what the signs and symptoms of drug overdose are. There's a wide range of signs and symptoms that occur when a person has an overdose, and everyone is going to respond differently. The signs and symptoms depend on the variety of factors, which include 1, what substance or substances did the individual take? 2, how much did they take? 3, the strength of the drug itself. 4, how it was administered or how did they take it? 5, the overall state of the individual's health. And lastly, their age. These are the determining factors for the signs and symptoms of a drug overdose. So when we look at the symptoms of the drug overdose itself, these include alcohol poisoning. They can be nausea and vomiting, severe stomach pain and abdominal cramping, diarrhea, chest pain, dizziness, loss of balance or coordination, being unresponsive but awake, limp body, seizures, drowsiness, and confusion. There can also be agitation, paranoia, slow or erratic pulse, difficulty breathing, shallow or erratic breathing, or not breathing at all, hallucinations, visual disturbances, choking or gurgling sounds coming from the individual, heavy, deep snoring, blue fingernails or blue lips, pale or clammy faces, or loss of consciousness. Any of these symptoms must be addressed immediately. So, what are the risk factors for people with drugs and what results in drug overdose? It's important to note that people of any age can have an overdose. Your risk factors for drug-related harm are increased when, one, the body is not used to taking a certain substance, meaning the first time you try heroin or cocaine or methamphetamine, that is when you're at the highest risk for overdose because the body's not used to taking in this substance. Mixing drugs, your body's tolerance for certain drugs to begin with, the quality or the content of what you've taken. If you use alone, your age and physical health play also a role in your risk factors for overdose. The mode of administration. How is it administered? Is it intravenous? Is it oral? Is it inhaled? And the previous non-fatal overdoses the individual has experienced. All of these are risk factors for drug overdose. So paracetamol overdose. Most people don't know it as paracetamol, but it is a common form of pain management and it's used to reduce fever. It's usually bought over the counter and it doesn't require a prescription. Surprisingly enough, another name for paracetamol is acetaminophen, better known as Tylenol. It is one of the most common medicines taken by young children in an accidental overdose. Paracetamol is commonly taken by people who intend to harm themselves or commit suicide. There is a small difference between the maximum daily dose of paracetamol and a drug overdose, which can cause severe liver damage. Large amounts of paracetamol are very dangerous, but the effects don't often show up immediately. They'll generally show up about 2 to 3 days after taking the overdose itself. Treatment must start immediately to effectively help the individual before the damage becomes permanent. In the event of a Tylenol or paracetamol overdose, the individual needs to seek treatment immediately, even if the person seems like they're okay. The signs of the paracetamol overdose are drowsiness, coma, seizures, abdominal pain, nausea, and vomiting. Again, always seek treatment for paracetamol overdose immediately, even if the person seems okay. So let's talk about the treatment for drug overdose. Medical care for a drug overdose depends on one, the drug that was taken, the dose of the drug, when and how the drug was taken, what else was taken with that drug, and the effects on the person, including any medical complications that result from the overdose. So these are all factors that must be considered when treating an individual who has had an overdose. If you go to the hospital for a suspected drug overdose, these are the things that typically the healthcare team are going to perform. One, a full assessment in the emergency department, which may include blood test, observation, and psychological review. To remove the drug from the body, for example, giving activated charcoal, which binds with the drug so the drugs cannot be absorbed into the body and cause additional damage. They may administer an antidote when possible, for example, naloxone, hydrochloride, which is better known as Narcan, Nizod, or prenoxidate. These are drugs that can reverse opioid overdoses. Individuals are generally admitted to a hospital for further treatment. And a follow-up appointment with your doctor is important for everyone who has had any type of an overdose. Your doctor can help to monitor your healing, advise additional treatment, and provide information on support resources. Self-care after having been given activated charcoal. Because this is a common practice in a hospital, it is important that you know what to do after you have received the activated charcoal. One, if you're given charcoal in the hospital, you will pass it within your next bowel movement, and that's usually in 1 to 2 days. Home care suggests that one, you follow all the instructions given to you by your provider, your doctor. You should drink plenty of water to avoid constipation. Be aware that charcoal could interfere with the effects of other medications you may be taking. For example, if you're taking oral contraceptive pills, you will need to use another method of contraception until the next period. If you are unsure how charcoal may affect your other medications and what to do about it, then you should seek advice from your doctor. So, why can an overdose accidentally happen? Well, it's unclear if an overdose is an accident or an intentional process. They may be a little bit of both. Regardless of why the overdose happens, it's important to treat people who have experienced an overdose with care and dignity. Accidental overdoses, if a person takes the wrong substance or a combination of substances in the wrong amount or at the wrong time without knowing what it can cause as far as harm is concerned. This may include people who take a drug for a certain desired effect, for example, to get high or to reduce unpleasant emotions, but they don't realize the strength or the ingredients of what they're taking. An intentional overdose, a person who takes an intentionally harmful amount of a substance or a combination of substances. This can be a sign of physical, emotional, or internal distress and is highlighted for some of the additional care and support that they need. So, regarding the administration or the mode of administration of drugs, Regardless of the mode of administration, if someone uses enough of any drug in a short enough period of time, they increase the risk of an overdose or the possibility of an overdose. Modes of administration that are delivering drugs more quickly into the brain or more likely to create a rush, such as an intravenous injection or smoking, which also places you at a higher risk for overdose. Transition periods can also be dangerous. When someone switches the mode of administration that they are used to, it is then harder to anticipate the effects that occur with that dose. For example, if you go from inhaling cocaine to injecting cocaine intravenously, it is difficult to anticipate the effects of the drug. Therefore, the risk for overdose becomes that much higher. So how do we prevent overdose? Well, there's some ways to prevent overdose is by practicing safe medicine. One, always reading the medication labels carefully. Take prescribed medications only as directed and keep all medications in their original packaging. Tell your doctor or your healthcare provider if you have had an overdose previously. Do not keep medications you no longer need. Return them to a pharmacy or use proper disposal of those medications. Keep all medications, alcohols, drugs, and poisons locked away in a safe, secure place and out of the reach of children. Be careful when taking different substances, including alcohol, at the same time. They can interact negatively and increase your risk of overdose. And you should consult your doctor or your pharmacist if there's any interaction questions that you might have about the medications itself. And so when we talk about the resources that are available to individuals who have experienced overdose or near overdose, just remember it's important that an overdose is a medical emergency requiring immediate attention. Regardless of the mode of administration, if someone uses enough drug in a short enough period of time, overdose becomes very highly possible. And regardless of why the overdose happened, it's important to treat people who have experienced an overdose with care and dignity. You'll see on the slide that you have in front of you, oops, can you go back for me? There we go. That we have provided local resources in Bexar County, in San Antonio, to help individuals who have experienced an overdose. And these resources will be available to you when the presentation has been released. So I conclude my presentation now, and I want to know if you have any questions regarding the information that has been provided.
No, ma'am, there are no questions.
Okay. With that said, we thank you for taking the time to